A lot of leaked documents here at Queen's Park in recent days about how the Ford government is planning to overhaul the health care system, creating a super health agency. Just today, we've obtained new documents showing that that agency has already been incorporated. One of the things that will be rolled into it is Cancer Care Ontario, and some prominent doctors, they're now starting to speak out against it.
I think there's a real risk to patient care, and I hope that Minister Elliott will lead a second look at this legislation.
Dr. Bob Bell is a real expert on this. He's the former head of Toronto's University Health Network, former cancer surgeon, and former deputy health minister. He says what really concerns him is Cancer Care Ontario and the Trillium Gift of Life Transplant Network being rolled into the super agency.
Ontarians now have an agency with a laser focus on providing the best possible care and the most cost-effective care. If we bury that direction deep in a super agency of bureaucracy, we're not going to get the best cancer care like we're getting today. A super agency is going to have a responsibility for ambulance services, for birthing services, for emergency departments. Are they going to pay attention to people on the transplant waiting list the way that Trillium does today? I don't think so.
You're worried that cancer care, transplants are going to get lost in this big super agency.
That's what's happened in other provinces that have adopted the super agency model.
But will the proposed changes in this bill save money? After all, the Ford government was brought to power to get the books in order.
Super agencies tend to increase costs. If we look at the Alberta experience, healthcare costs in Alberta are $1,000 per person more than Ontario today. If we took the Alberta model today, it would cost us $14 billion a year more, not less. This is poorly thought out. It's been rushed without consultation, without stakeholder engagement, and most important, without asking patients and their families whether this is the right route. I do not believe that this will save money.
And on reports, the Cabinet may have already approved part or all of this bill, despite the health minister initially saying it was just a draft.
Certainly, I would say, looking at this legislation, the 81 pages of draft legislation look very much baked to me. I hope Minister Elliott will take a second look at that.
As for all the leaked government health care documents we've seen from the NDP in recent days, the OPP said its anti-rackets division, which investigates matters of political corruption, is taking a look at the case, though is not yet officially investigating. On Hospital Row, Richard Southern City News.